So I'm kind of punting right now as we wait for that, but David is certainly very involved in the usage of this research and can speak to the actual interventions and solutions that it has contributed to. So we'll be talking 12 minutes or so, and
Yes.
you're going to have to stop me because I tend to get started and I have about, 17 slides, so we'll go through them pretty quickly. But the City of Seattle Technology Access and Adoption Study is a study that's been conducted. It's the 5th time, I do believe. It's kind of gone through a few iterations. It's conducted every 4 years, and it primarily started back in the early 2000s as a way to really measure the access. So we talked a lot this morning about how that really is a conversation that started, right, and certainly in the United States, how many people have access. It's evolved over time, though, to really study more about the levels of adoption and the reasons why people are adopting and engaging. So, as I mentioned, this study has evolved over the course of its inception in 2000 to really start looking at why people are engaging with technology and adoption, why they are not engaging with technology and adoption, and what are some of those barriers from a consumer or from a resident standpoint as opposed to from an actual access standpoint. So we really wanted to understand holistically what are the reasons why they're engaging at very different levels. So if I go here, excellent. So I'm going to talk a little bit about, let me go down here actually, some of the methodology that we used. Obviously it's a challenge, and we heard a lot about this this morning about data and how do we reach some of these particular populations that are potentially more underserved or differently served. And so we really took a very hard look at the ways in which we were going to reach out to the residents and the citizens of the City of Seattle and the ways in which we were going to engage them. So we had varying different levels. First of all, the study was primarily a mail-based survey. Obviously, we cannot be measuring technology adoption online, but only limiting our ways engaging online. So we looked at that as sort of our primary way. We did offer ways in which people could engage with us and give us data, whether that was online or over the telephone, but it started primarily as a mail survey. We also know that there are certain underserved groups that tend to be less likely to participate in this kind of research, primarily socioeconomic, but also people of various racial and ethnic backgrounds, people living with disabilities, people, older adults. All of those populations are less likely to respond to this research. So we oversampled varying groups, and we worked with varying partners within the community in order to give us access to those groups at a very robust level. So up here you have sort of the varying segments of the broad groups of individuals that we spoke to. We did a general population study. The general population study was a mail-based survey, sampled stratified to the council districts of City of Seattle because we wanted to look at differences in adoption and access rates across the City of Seattle. There are certain areas in the City of Seattle that are differently served from both a broadband access point as well as certainly there's some significant differences in income and racial and ethnic makeup throughout the different areas of the city. So it was important that we stratified it that way. We also did an oversample of census groups that were living at a 70% or higher percentage of low-income groups. We worked with the Seattle Housing Authority, which is the provider of low-income housing through their buildings in order to oversample their populations and include individuals who are means tested and certainly qualify for lots of different programs that are subsidized. Certainly anyone that lives in the Seattle Housing Authority population is living at below 135% federal poverty level, which was one of their major segmentation points so that we could understand that group. We also reached out in person to individuals that were living in city-sanctioned tiny home villages, so the insecurely housed population could be represented in that way. And we finally worked with the Seattle Public School System to do a full census of all of their parents and guardians that was done online, and that was also to understand some of the aspects of, or potential aspects of, negative influence or use of technology in ways in which people may have some differing attitudes about the appropriateness and certainly in the school systems in the city of Seattle, there is quite a bit of conversation about what does that look like or what should that look like, and what role does technology play in educating our children. And so we included that very robust sample from the Seattle Public Schools parents and guardians. I do want to just make one more point in that it's very important to recognize that all of this was a paper self-administered survey with the exception of the Seattle Public Schools. that was an online-only survey. However, obviously there are plenty of individuals, and we had almost 20,000 paper surveys go out via mail. Many of those individuals certainly have families in the school system. We also did segment and looked at, and we have tons of data and tons of reporting, but we also looked at the private school sector as well. And that is an additional cut. Just real quickly, these are our sample sizes for some of the groups that I think are of particular interest to this conversation about digital divide. These are the traditionally underserved groups. So primary language in the home other than English, we had 244 responses. Race, ethnic minorities, 931. Insecurely housed, either self-defined or living in a tiny home or insecure encampment, 56. Do note that is a small sample size, so we don't really talk a lot about that. We would consider that to be directional only throughout the reporting. 879 older adults, 412 classified as ultra low income, meaning that they're living below the 135% federal poverty level, and they are qualifying for pretty much any means tested program. 1,543 residents of MDUs, 435 people living with a disability, either within the household or themselves personally, and 1,454 living in a home with a child or more. Real quick, we did compare, I mean, certainly you can't have a conversation about access and adoption without just kind of first talking about access. The city of Seattle is a very well-connected city. We're a very wired city. We're an urban environment. This was totally confined to city of Seattle, so certainly the urban conversation is very acute here. We are at 95% of individuals reporting that they have a way to access their internet in their home. So that is certainly comparable. With the ACS, 98% have a device, so that gap there is people who don't have a way to connect to the internet in the place that they live. They have a device, they can go someplace else and Wi-Fi hotspot it. So very high level of connectivity, and it's up from 85% in 2014, the last time this study was done. Certainly a lot of data there. I'm actually going to skip ahead a little bit because I think we are kind of limited in time. Although we have very high levels of access, we certainly identified some very significant underserved groups. Those that are living insecurely housed are 7 times more likely to not have a place in which to access the internet. Those that are living in low-income households, so these are households, so they are homed, they are 5%, sorry, not 5%, 5 times more likely not to have any internet access. And then if you look at adequate internet access, it's actually 60%. So 60% of individuals who are low income living in the city of Seattle say that they don't have adequate internet to do what they need to do, whether their child's education or themselves in terms of looking for employment or accessing government services. So some very high rates again. So the conversation really isn't about the fact that 5% of the population doesn't have internet access in the city of Seattle, but that these groups that we traditionally see as underserved are at astronomically high rates. I normally have 5 minutes, so or actually even less now. So certainly affordability is a significant issue, and if I had to probably pick one about the challenges that the city of Seattle is facing, it is affordability. We have certain providers. We have one major provider that the average cost of receiving that, depending on where you live, and it varies throughout the city of Seattle, is at least $100 a month for just internet service or internet bundled related services. That doesn't include the cost of the device that actually to access the internet. Internet costing too much is the #1 barrier cited by City of Seattle as to why they cannot access the internet more. Followed by not having a device, which often is related to cost. And then also there is a significant number of individuals that are talking about the complexity of the service plans and their concerns or insecurity about talking to the ISPs. Awareness of internet related programs that serve the needs of the low-income residents is very low. Usage and adoption is quite low, and certainly David could speak to this more. This is one key piece of information that the city is using in order to continue that conversation and increase that dialogue for the people that can benefit from it. And then finally, I want to talk just briefly about some of the kind of bigger pieces, because we talk about access, we talk about affordability, and then we also have all these other reasons why people are not engaging and adopting. And one of the things that really resonated this morning as I was listening to individuals talk about this is that this is not a mutually exclusive problem. And if we try to treat it as a mutually exclusive problem, it's that whole thing about electricity and access and broadband access, same thing here. I mean, we tried to kind of mutually exclude this or create mutually exclusive categories to illustrate why people are or are not fully engaged. And we did that, but it's so important to remember that this is a hierarchy. And that yes, you have 3% of the individuals who are totally purposely disconnected, but then you start getting into these other groups that are not, like, you don't solve the problem down here and say, okay, we're going to teach the 14% that don't have the skills, and then all of a sudden we're going to have a hyper-connected individual. You have all of these other groups that are going to be, there's cross-morbidity types of factors that go on. The access stress is really about, yes, I have a way to access the internet, but it's not enough. And I'm worried about affording that device. I'm worried that on the 25th of the month, I'm not going to have any more minutes anymore, and I'm not going to be able to go online and pay my rent. So anyway, I know I'm out of time, so I will go ahead and stop there. I have so much more, but I am excited to hear what's... Turn this off?
I can do that.
Great.
Don't worry. Thank you.
Okay. So I will skip quite a few slides. I have too many, I've realized. So I will be telling you the story of CCPF, which is Chichewa for Health Center by Phone. It is currently a national health and nutrition hotline in Malawi, East Africa, where I've spent the last 2 years. And what you're seeing in the photo, that is Patience, a good friend, and the hotline supervisor. She's a nurse and nutritionist. Eric, also a trained nurse. They work out of a small building at the Malawi Ministry of Health in Lilongwe. And so just to give you a sense, mobile phone coverage, much lower than Seattle, access to internet. So this is data and phone calls than the city of Seattle, of course. So out of a population of about 17.5 million people, it's a small country, you have about 7.7 million cell phone subscriptions. Urban areas, of course, much better connected. Significant divide between urban and rural areas, but keep in mind that Malawi is primarily a rural country. More men than women own mobile phones, and these are not the smartphones, these are just any mobile phones. And you have two telecommunications giants, Airtel and TNM, that are pretty much sharing that market. So we're looking at about 4.5 million Airtel subscribers because Airtel has been allowing free incoming calls to this hotline since 2015. So it's a public-private partnership at the moment. One specific aspect they should be aware of, because such few people have mobile phones, sharing among families and communities is very common. So health center by phone, it's Chipatala Chapafoni in Chichewa, so you'll hear the acronym CCPF a lot. It's a short code free from any Airtel phone, so not TNM phones. Airtel was smart to include an exclusivity agreement with us in our annual memorandum of understanding. It was launched in 2011, so it's about 8 years old. But up until almost 3 years ago, it was specifically a hotline for pregnant and postnatal women who are calling for maternal and child health issues. In mid-2016, we decided to open it to any health topic, any caller, and you'll see some of the results of what happened. And I don't think anyone really know what would happen once you open it up to the whole country and to any health topic. So anyone in the country can call. There are many donors, including PEPFAR through the U.S. Department of State, that are funding USAID. VillageReach is our nonprofit health organization based in Seattle, but with offices in DRC, Malawi, and Mozambique. We have Johnson & Johnson that has actually funded the evaluation along with BREAKOUT Foundation. I'll be talking about our evaluation results in a second. And we have the German government as well pitching in. The hotline is transitioning as of July to the Malawi Ministry of Health officially. We started the transition process about 2 years ago. And in addition to just being able to call and talk to a trained nurse or clinical officer or medical assistant or nutritionist, people can also sign up to receive text messages weekly or bi-weekly on very specific topics: pregnancy, young child health. So this is for children under 1, just helping new mothers. Maybe you don't have to go wait in line at a very busy health facility for hours just to ask basic questions about your child's health. And then more recently, we introduced for adolescents and youth, so this is 15 to 24 age group, we introduced messages about HIV prevention and sexual and reproductive health, because Malawi has one of the highest teenage pregnancy rates in Africa and the world, and also especially young adolescent girls are very vulnerable to HIV infection. We have used a local IT company, Baobab Health Trust, to capture the data. So when the phone calls come in, there's a touchscreen computer, and the nurses are capturing data about the calls and the clients. What are they calling about? What advice they received, age, etc. Some basic demographic information. And there is an interactive voice response system. And we have just moved to Viamo, which is a US and Africa-based IT company. So there's a brand new software, brand new computers. We're moving up in the world. So we started in 1 district in 2011. We were in 9 districts last year. And then as of late 2018, we have started to advertise nationwide with the Malawi Ministry of Health. You can see how much the call volumes have spiked and how we moved from just maternal child health starting in 2016 to all health topics. And we get a lot of calls about clinical topics, everything from cancers to neck pains to headaches to diarrhea to whatever you can imagine, heart disease, blood pressure issues. People are calling about everything nowadays. So we did an evaluation in 2018, VillageReach, together with GMAT development consultants, to try to assess what was CCPF's impact on individual health consumers and more broadly on the health system in Malawi since 2016, when we opened it up to all health topics and nutrition. And we did that in 9 districts where we had advertised the hotline. So those are the districts in red. And then we had 4 control districts where in mid-2018, when we did the evaluation, we hadn't yet advertised, so most people didn't know about the hotline when we weren't using it. So it was a progressive scale-up. We had quite a few different things we're trying to measure, from health knowledge and behavior, where CCPF users more likely to exhibit certain types of knowledge and healthy behaviors than non-users. Was the quality of information that the nurses were giving good? Because you can cause more harm than good if you're giving wrong information over the phone. Were we successful in linking people for continuity of care to the health facility? So we advise people sometimes to go to be seen in person, get certain tests done, get certain medication. There are only so many things you can do over the phone. The backbone of the survey, of the evaluation, were household surveys. We went to people's homes. We interviewed over 1,200 people. And we purposefully decided on 2 comparison groups. There were in the same communities in 9 districts, we took people who had called CCPF and people who didn't. But then we also took people in a second comparison group in 4 other districts. So what can I tell you? We are very pleased. So again, in 2016, when we opened it up, we had no idea who would actually call. We're very pleased with the great diversity we have achieved, especially in underserved groups. People are calling, men and women are calling almost in equal numbers, slightly more men, which is reflective of cell phone ownership in Malawi. All ages, a lot of youth, because we advertise the hotline to them intensively. So it proved to be extremely popular among the 15 to 24 age group. A lot of people still calling about very young children under 5 and especially under 2. People are calling from all walks of life, people who have no formal education to people who are going to college, people who cannot read a sentence in Gibeault to people who can, people who are in very low income areas or in homes that are thatched roofs and everything you can possibly imagine. Most of our callers are farmers, which we're very pleased with. We didn't just want people from educated people from urban areas to call. And a lot of them are small traders. They sell things in the streets, so that's the informal economy. Very few actually calling from the formal, who have formal employment. About half have access to bank accounts, savings and loans accounts, and you can see they're calling about literally hundreds of health topics. Does diversity equal equity of access to information? That's a totally different story, and I think equity of access is in the eye of the beholder. So what I can tell you is the facts. We've answered over 118,000 calls since 2011. It's really intensified. We've really advertised in the last 2 years, so we're averaging about 2,000 calls per month answered. We are literally limited by our own staffing numbers and budgets, and the ministry probably won't have any bigger budgets for a while, but people are calling and we're currently not able to meet the demand. We've had over 5,000 call attempts last month and we've answered about half of those. We have 30 nurses working there at the moment. So there are trade-offs, and that's where you start to wonder, does that mean that if you have diversity in underserved populations, you've achieved equity? It's a priority for the Ministry of Health in Malawi to target the youth with sexual reproductive health information. And the youths are calling and calling and calling, but they're hugging the phone lines. So if you have a 70-year-old in a village, a remote village, trying to ask about a very serious health issue, and she can't because you have all these teenagers calling about sexual reproductive health. Is that equity of access? I don't know. But it is a priority. Public health is in such a way that you're targeting, it's the law of large numbers, right? So you're trying maternal and child health calls. This started as a maternal child health hotline, steadily declined, or at about 10% of all calls being about maternal child health, because people are switching to call about things they're worried about. Clinical issues, not so much about what do I feed my child tomorrow. And more male calls nowadays, but it turns out that men actually do share the phones and they call for other people as well. Of course, the people who are accessing are the people who have good connectivity, and it's the people who have Airtel connectivity in their communities. So there's a huge effort, petitions going around trying to get the government to bring the competitor TNM to the table. And of course, Airtel is not happy about that. So we'll see how that shakes out in the future. I will skip there just to give you a sense of some of the results of our evaluation. Maternal health, we had some good results, a very stubborn indicator that most public health programs haven't been able to move the needle on, getting women to attend antenatal care as early as possible during their pregnancy, in their first trimester. We've actually shown some good results. So pregnant CCPF callers are actually more likely to start antenatal care early. We've had some good results in terms of preventing diseases in children, not so much treating. We've had significant impact on sexual reproductive health. So again, a lot of these callers are youth, but not necessarily. Some are older adults. We've seen that people who call CCPF were much more likely to have tested for HIV in the last 2 years, to have used modern contraceptive methods, and to use a condom last time they had sex. So this is also preventing HIV and also pregnancy. Nutrition, what we've seen here is that CCPF users are much more likely to know the importance of providing diversified daily diets to themselves and their children, but they're not necessarily able to do so, and they primarily cite income concerns. And 87% of all the callers that didn't call necessarily about these 4 topics, but anything you can imagine, 87% said they followed the advice given by a hotline nurse and they were able to provide specifics about it. So I will skip the next slides, and I think I have 5 seconds left. But high user satisfaction, 98% of people, especially the ones calling with very sensitive health issues like HIV, I'm young, there are all these rumors about sex. What do I do? People have urinary conditions that they don't feel like talking to anybody else about it. They feel really comfortable over the phone, and customer care gets very good ratings. 99% they're willing to call back. The hotline is free, but we ask the question, willingness to pay, very hypothetical, but gives you a sense of the value people place on the service. 57% would be willing to pay, and another 11% would call in case of emergency. And then we had independent clinical experts actually evaluate the quality of the health information given by our hotline nurses, and they got an average score of about 80%, which we felt pretty good about because they literally have to have constant trainings now about every health topic you can possibly imagine. 88%, we felt really good about this, 88% of the CCPF callers who were referred to health facilities went. There's very low trust in quality of care in health facilities in Malawi. So people weren't happy about being sent to health facilities, but they actually went. In some cases, they were grateful it saved their child's life, that they actually bothered to go to the health facility. So what we found is that we're not able to meet the demand. That's number two. People actually like talking to a live human, so we're considering automations to be able to meet the demand, but we have to keep in mind that people like that interaction, having someone they can talk to and personalized advice rather than group advice. Obviously, people want more access to even from TNM areas, and we've had difficulty with our data capture system. We're still trying to perfect it, and it's been very slow. But the big news is that it is moving to the Ministry of Health. We're trying to ensure sustainability, replicate the hotline in other countries, and try to come up with different semi-automated measures to meet the very high demand. Thank you so much.
Thank you.
Hi, everybody. My name is Michelle Gibeault. I'm an academic librarian at the University of Arkansas Libraries. And 2 years ago, I was appointed to chair a task force by the mayor of Fayetteville, Lionel Jordan. I begin with this slide. Actually, I use this slide a lot. This is a screenshot from a TV show called The Wire. And it was actually filmed on location in just south of here, I believe, in Baltimore. And if you look closely, you'll see that this is actually a book from the Enoch Pratt Library, which was Carla Hayden's library before she became the Librarian of Congress. And one of the things I think this also points to is the fact that libraries have always been, or at least in the beginning, were really involved in sort of helping people get on the internet in the first place. And these are questions that I think about as a practicing librarian. And how I got into these issues was actually through net neutrality advocacy. Thinking about particularly zero ratings and the way that they offer access to only a certain corner of the internet and actually shape digital literacy, and how that's not really fair if other people were able to access the full internet. So that's how I came to this, also with the idea that sort of as libraries build digital libraries, we're involving only certain segments of the population who have access to the internet. So it's really delightful when I run into other librarians involved in these conferences, because I think these are the issues that are really sort of keeping people from accessing libraries and library resources. And when I talk about library resources, I'm also talking about OER, which many of you might not be familiar with. It's open educational resources. The idea that textbooks need not cost $300 a pop, that many times people are willing to write a textbook and offer it for free online, but then are people able to access it at home? Whether or not they have internet access is an important issue. Also, many other digital collections and collections as data issues hinge on access to the internet. So I'm here today to speak on behalf of the entire task force in Fayetteville, Arkansas. And in case you don't know where Arkansas is, many of my colleagues don't, we're north of Louisiana and in between Oklahoma and Mississippi and directly below Missouri, the northwest portion. We're well known more recently for having a lot of investment from Walmart. Alice Walton still lives in Bentonville, and she has a huge museum that she's built, and she continues to give back in all kinds of really interesting ways. Right now she's looking at building an integrative health center that will be state-of-the-art in the United States. So that's coming. But our task force represents the city of Fayetteville, which has about 85,000 residents. And it's difficult whether or not to include the 27,000 or so students who attend the University of Arkansas and represent 50 states and more than 120 countries. These are all members of the community. Our mayor focuses on the word resident instead of citizen for reasons that we can go into if you want to. And we're the third largest city in Arkansas. So the task force comprises myself as chair, but then also a number of other people who are really focused on these issues in our public. The leader or the director of the public library, a board member of the public library, a city council member, an expert in mapping from the libraries. We haven't really been able to use her expertise as much as I'd like, but that's why I invited her to be on our task force. Our director of IT, Keith Macedo, has been a really important player in terms of helping translate the things that we are thinking about into sort of practical measures that the city can sort of take on. And then our communications director. Much of what I have to say here today has to do with communicating these issues mostly to rich white people. And so thinking about talking about these issues and hopefully influencing the conversation and moving the dial in terms of how it's thought of as a public interest issue is really what Susan Norton helps me and the rest of the task force think about. And then we had somebody who's a journalist from RCR Wireless volunteer to be on the task force, and he's been really useful in terms of helping the public engage with questions about 5G in particular. So this is something that we've kind of taken on as our I don't know, our mantra or our idea that helps people understand what we're really doing. Our mayor is a really wonderful person. He's a former carpenter at the University of Arkansas who was elected mayor several years ago. And his idea is that every student should have the resources to complete their homework at the kitchen table. So this is the idea that homework will inevitably change, and the bandwidth necessary to do homework is something that we need to think about. We shouldn't be thinking about homework as static. We should be trying to imagine what students will be asked to do 10 and 20 years down the line. So the digital inclusion plan will be tied in with the city's other master plans. We have many of them, and this is something that we're working on. We use a tool known as Speak Up Fayetteville, which I can't remember the actual branding for that, but if I can look it up if anybody has questions about it. So any member of our community can easily see what we've been doing lately by clicking on Digital Inclusion Plan. And by the way, the language here is a little bit imprecise. We don't have a plan yet. This is something that we're building and working on, and really building on cities like what Seattle is doing. Charlotte has been someone we've looked at closely as well. So what we started with was this idea of public engagement, where we can learn what we can from people who are in the community and see what their concerns are and sort of begin discussion. So luckily, the very first person who was willing to come to town was a really wonderful speaker named Joanne Hovis, who runs CLIC, the Coalition for Local Internet Choice. And one of the things that she really focused on was this idea that if our community wants to think about building broadband infrastructure, that we can think about public-private partnerships and think about maybe even building just sort of a loop of our own infrastructure, and by that I mean fiber, and then lease it out as a way of sort of attracting more providers to our community, which already has 3, which is really unusual, and I'll go into those 3 providers in a second. So this kind of laid the groundwork. We had an expert come in and talk about sort of the conversations that she has with many communities. After that, we asked somebody who's local to us, who is a professor of classics, but runs what's known as the Tesseract Center, and he does a lot of VR and AR, and by VR I mean virtual reality, and AR is augmented reality. And one of the things Dr. Frederick was able to talk about is how homework will change, and why it should change, by the way. Not technology for technology's sake, but just this idea that homework is hard when you don't have good feedback. When you sit at home by yourself trying to figure out what the answer is, and your teacher is, tomorrow away. Dr. Frederick says that basically we can use technology to make homework faster and to make students really learn at their kitchen table, as as our mayor would like. By the way, one of the things I'd like to point out is that all of these are available through our public library live stream. So if you're interested in any of these specific conversations that we've had, you can watch them yourself. The next thing we did is we had a forum known as Internet Access, Quality, and Affordability in Fayetteville, and we were able to attract all 3 of our broadband providers to have a conversation about it with us, AT&T, Cox, and Ozarks Go. One of the things that was really pivotal for us was sort of a discussion about sort of gigabit access, because basically Ozarks Go is an electrical cooperative that is offering gigabit access to about half the town of Fayetteville right now. Anybody they offer electricity access to, they offer also the opportunity to purchase gigabit access. So this was an interesting question, because we had people from other vendors saying some people don't need gigabit access. And so this idea of what are the needs and what are the future needs is a really common theme of the discussions that we're having at the moment. And then finally, this was a discussion between 2 different people on the task force who had specific expertise. Sean Kinney talked about 5G, and I talked about sort of this idea of net neutrality and sort of helping people understand why this is a social justice issue. And what was hilarious about this one in particular is that our local Fox News affiliate reported to the whole community that Mayor Jordan had reinstated net neutrality, which they didn't exactly take away what we were actually talking about, which was one of the things that really I learned so much about, is that even when you're talking to people who use the internet all the time, literacies about the internet are not what they could be. So one of the things that I really find myself recommending quite a bit is this book, Susan Crawford's book about fiber and the history of access to electricity, and how, sort of the vocabulary that we all have about access to the internet could be improved. And so when I talk about talking to rich white people about this issue, offering a book that they can check out and read is something that I think is pretty important. Talking about this last mile access, that only the wealthiest American households have this. This is the best sort of visual metaphor for the difference between copper and fiber. The idea that copper is a 2-inch pipe and fiber is a 15-mile wide river. So using that to help people explain sort of the context of what we're talking about when we're thinking about access to quality high-speed internet. This idea of data transmission delays, understanding what latency is something that everybody has sort of practical knowledge of, but doesn't necessarily know how to talk about it. And then finally, this idea that we've been here before. She goes deeply into how Roosevelt was elected in the first place, which is why the fact that he was willing to go to bat with people who thought that, access to electricity was just something that, rich people should have, and, you didn't really need it otherwise. So, "Judge me by the enemies I've made" was one of his key quotes that had him elected president in the first place. And his enemies, by the way, were people who thought that, electricity shouldn't be regulated. So this book is a really excellent one if you're trying to sort of move the dial in terms of talking to people who maybe could it also improve digital literacy. So this is just last night. We finally got together basically what was known as a resolution. The mayor and our city council member put it together, and it's available here under this date. And this is the key component. How do you talk about all of these issues? How do you make them clear and concise, and how do you make them planks? So we basically focus on access, technology, digital literacy, policy, and opportunity. And there are a bunch of different ways we can talk about this, and I don't have a lot of time left, but one of the things I want to talk about is digital literacy and opportunity bleed into one another. When you're talking about having cybersecurity practitioner trainings at the public library, that's more in this zone. But when you're talking about teaching people to use the internet securely and protect their privacy, that's up in this zone. So they kind of bleed together, but these are the sort of 5 planks that we'll be working on. So here is my final slide, what we've learned and questions we're thinking about. The first one is that the FCC definition of broadband is at odds with what we already know are the needs of Fayetteville residents. We're planning gigabit or bust bumper stickers to promote the digital inclusion plan because this is something that we want people to have questions about. One of the really good ways to get people's attention is to be like, oh, I saw somebody with a gigabit or bust bumper sticker. What does that mean? So that's our plan. Multi-family homes and apartment buildings may have fewer provider options. We think that some providers are making deals with apartment buildings where basically they run fiber or copper to that apartment building, and then the residents of that building only have access to one provider, which cuts down on competition, cuts down on price or affordability, I guess is what I mean. We can put together some kind of rulemaking or an ordinance that will address this, but we need data in order to do it. And so one of the great things is that we've been doing a little bit of what you've been doing, although I'd really love to look at all of your slides because the University of Arkansas has a communication department, and I've been able to work closely with them to begin a mailer survey, which we sent out to 4,000 households, and will give us sort of a baseline of data, and that deadline is going to be May 31st. So we don't have our data yet, but this is really what we're focusing on, is seeing if we can prove this. If we can prove this, then we have a really good way of buttressing why an ordinance would be a good idea. 5G deployment is requiring a lot of municipal attention. Will it be possible for us to redirect the fees that we charge towards funding some of our digital equity goals? This is something that we want to look at. This was an idea of Susan Norton's, who is somebody who, she's our communications director now, but she's had a long career of sort of thinking about clever ways to make sure that you're directing your funds in ways that actually help your broader goals. And then finally, data and mapping are wicked problems. These tie into larger smart city data issues, which is something that I really look at closely. And one of the things that you'll start to see discussion of more and more is this idea of data trusts. Because you can't just publish all data and make it completely open. You need to be able to have sort of people who are overseeing the data and thinking about the long-term consequences and making sure that it's available to some who really need it, but making sure that it's not breaching privacy, or making sure that people feel comfortable with the way data is being gathered about their use of electricity and internet and all of these things. So my long-term research question has to do with civic organizations, local governments, and libraries. How do they act as data trusts and data trustees? You'll see that the City of London has sort of a data trust approach that they're starting to think about, and that's something that I'm keeping an eye on closely. So thanks so much for letting me speak and for your interest.
So this is a collaborative presentation based on university research. I'm a digital literacy scholar at the University of Utah, and my research work started in 1999, looking at underserved populations coming to new technology. And during that time, it was the Clinton administration, and I was looking at digital divide issues. And then over time, the second wave of digital literacy came, where we were talking about, during the Bush administration, it was called digital inclusion, because we were looking at issues of connectivity anywhere instead of just in the home, which was what the digital divide was about. So then I started looking in other places such as community centers and so on to connect to the divide. And then the second wave of the digital divide, we were looking at literacy in terms of how people use technology in public and private spaces. And then fast forward to now, and I am looking at how people produce online. So there's this other digital literacy divide, and the word inclusion is now used. Since the Bush administration, inclusion has been used, which is problematic for me, and I can go into that much more if you want, in a theoretical perspective. But I prefer the term digital fusion or digital equity. So my next project, I will be working with our Salt Lake City Public Library to teach underserved populations about VR, using VR and AR. And one of the motivations for this is Salt Lake City, or Utah, but Salt Lake City in particular, is a unique place because we have more than 60,000 refugees. And the majority of those refugees are in Salt Lake City from countries like the Congo, Burundi, Mali, and so on. And in one elementary school, in one of the school boundaries, library, are 30 languages spoken in one elementary school. So with that in mind, and the fact that these countries are in the lowest 10 of internet readiness in our country, and the U.S. is in the top 5, this is something I see as a tremendous need. So Nole is here to talk about what the city is doing to help in that, and how the city got involved in that. So I'll pass this over.
Okay, thank you. It's, we have a small group, but I'm kind of excited about the group. I've watched the Seattle, I've watched you guys, and I've read, if you wonder if anybody ever reads your policies or all of your statistics, I've been reading them for years. You have a reader, and I've been watching you in Fayetteville as well. So Salt Lake City is in a similar place, I think, is where you are, where we're working on our digital equity policy. We're trying to set that foundation at the city to do that. I do our briefing on Tuesday when we get home to have that, and then hopefully we'll move right into a more formal strategic plan and such. And I'll kind of skip through some of these statistics, but Salt Lake City is a very unique place right now. We're #1 for state population growth. We're growing like crazy. I've watched housing. I was in community development for a long time. I'm in public services now, and I watched all of our housing trends. We were going from 2 to 3 to 4 subdivisions a quarter to now we're having 1,000 units coming online. The construction boom is just wild. And in our school systems, we're moving towards a minority majority, and as Joey pointed out. So we've got all of this diversity happening. We have a massive amount of in-growth. The people are leaving the coastal because the housing is so expensive, and they're coming to Utah. We can ski, we can bike, we can get to work in a couple minutes. And so it's really, really growing, and that is placing this demand for us to focus on the policy and such. One of the other pieces that came to it is Google Fiber came to Salt Lake City. So one of my assignments was putting the Google Fiber package together. For Salt Lake City, I wrote the applications, I did all the legal work, and then crafted a way for them to do construction in Salt Lake City, which created this huge boom. And when we were doing that, the political process that is associated with bringing in a massive piece of infrastructure, they were like, well, Google's going to solve all our problems, right? They're just gonna start handing out money, right? Everybody's going to get a bunch of money, right? We're all going to get a bunch of money. But that couldn't happen because they didn't have any policies in place for them to we did not have any policies in place for them to leverage. We didn't know what we wanted. We didn't know what we needed. We have a lot of other agencies within the city. We're a very philanthropic place where we have folks that want to start making smart investments in our community. And so that was one of the things that really started driving this is we have we are seeing opportunities, we are seeing this gap, and we need to have something in place to help guide that community investment. What I'm trying to say to our folks is we need to become the community impact managers for that kind of investment in our community. So our process, we got started, we went through a very formal process for developing policy. One of the things that I like to do is go through a pretty formal process. So I had an initiation package prepared, had it signed by the mayor. We outlined a scope of work as to what that public engagement process would look like. And we developed and started working with key organizations in our community. I got to meet Joy through the Utah Communities Connect organization, and I think that's a lot like your task force that you're talking about that you have. We've been talking about this policy for a long time, but it was just the city, right? We didn't have anyone to lean on. And it's one of those things that the city just can't do by itself. We needed community partners. So as this Utah Communities Connect organization began to mature and began to bring more and more folks into that conversation, the time was right for us to really try to go after it politically. And so we were really successful with that agency in getting the buy-in that we needed. And I think our policy is good. We went to our Human Rights Commission as our advisory board. We wanted to go through a proper advisory board process. We went to Human Rights Commission, and it was really fun to go with that work group to that board and meet with them on this, because I don't think they get to really be the recommending body on a lot of policy. So they took it serious, and we met multiple times, and they really helped us wordsmith it, and they took a lot of ownership. And one of the things that kind of stalled us out, which was fun, was everyone on the board wanted to sign it, right? Everyone wanted to sign it. So I think we were really good. And now we've got our transmittal with the Salt Lake City Council, and on Tuesday we'll do that briefing, and then our mayor's budget moving forward. We're doing our budget hearings right now. She's recommending a position for us to start working on the next step. This is just sort of a statement of purpose, and I think it's something that you've all seen. It's very similar to what you're seeing in the other places, and I think it's very exciting that a lot of cities are doing this. And in some ways, we feel like we're around the cutting edge, and at the same time, we look at the work that you guys are doing and have done for a long time, and it's great to see and have that mentorship. So our next step is to get this policy in place. It is to then hopefully get some staff and start working and developing that strategic plan and the goals and the values. And it was really fun for me to listen to you and what you guys are doing and stuff, because I think we're going to hope to leverage and hopefully get some advice from you on the best practices there and what's being successful and what hasn't been successful. I posted some links to it. I didn't know how best to share with the audience at this, so I just posted it on Twitter and to LinkedIn. The URL to our agenda service is very long. It's not as comfy as that, so as convenient as that. So.
It's our competition to see who can have the longest.
The longest URL, yeah, and so it's exciting for us right now. Our library is leading out. We have a digital equity person within our library. They're heading up the Utah Communities Connect. Joy will be participating with them, and we feel like we're about ready to go forward into a really new era for Salt Lake City.
So, and just to wrap up this talk, we did good on time. So part of this, just to give a little bit of background too, I have all of my degrees are in communication, yet I do work in education and in library sciences and in sociology, because my theoretical background is in social theory. And another professor had his course read my book called Digital Fusion: A Society Beyond Blind Inclusion. And a student, Shauna Edson, read the book in class and applied for a Google Fellowship and got it. And she got to work through the library, and then it turned out we were in the same department, and she was a grad student there. And that's sort of how this started coming about, and she and I, she changed her advisor to me, and then we started working on projects together, which is really exciting, and I kind of see this as the next generation of digital divide scholars, which I'm so excited about because my mentor was actually Susan Kretschmer, who put this together, and she was excited when I was her mentor. So we're seeing these generations, which is just makes me all warm and fuzzy. But so now Shauna is the one who's the lead on Utah Communities Connect. And just to give you an idea of who the stakeholders are, aside from the city, there's the university represented through me for the University of Utah, but we also have representation from BYU, Brigham Young University. We have representation from HUD, the Housing Authority, which is incredibly important because they're very involved in wanting to see people in their housing units get that kind of access. Let's see. There seems to be a big thing going on between AT&T and T-Mobile, who are always like, we volunteered, we'll give an extra. So I love that competition. Google Fiber, of course. There are just so many, the school district, there are so many stakeholders, and it's actually a state group. So we've got stakeholders from all over the state, and there's a huge difference between northern and southern Utah. Southern Utah is incredibly rural, and the topography is such that it makes it sometimes difficult. If you can think, we have all these national parks where people live around those areas, and we have reservations and so on. And so there are a number of groups that do not have access. We have things like telehealth at the university where, and Moran Eye Center, where there are people who are blind down south who can't make it up north, and they have community centers that they go to get medical or advice and that sort of thing from there. So we're trying to work with all of these groups, but we're starting small with Salt Lake City, particularly since we have this large group of people here, and we're hoping that other cities and counties throughout the state will come on as they can and as their municipalities become part of this program. So I just wanted to give you a broader picture of how this works in the state, because we are working on it. So we have time. Yes, ma'am.
So I try not to be the person who's always arguing about words. I try and pick my spots. I know what librarians tend to do. So I really would love to hear why, because I tend to agree with you, digital equity is something that you prefer.
Okay, so because I come out of the social theory background, and I think about the word inclusion and power dynamics, and inclusion means that there is a power structure to which you are included. And when I took a class on multiculturalism at the University of Illinois, a professor said, I don't like the concept of a melting pot. She said, I prefer a fruit salad. Why can't everybody keep their tastiness and just come together and to create something really beautiful? And I just remembered that as being, I work in a place where I did 4 years of, I'm an ethnographer, so I did 4 years of a qualitative study with Mexican immigrants in a very wealthy mountain town. I won't say what that town is. And, they couldn't articulate necessarily what they wanted or how the internet could be good for them. But what I learned through this process was that I taught an after-school program for children, and then I went into the homes and taught the parents, and there were multiple generations in like a 2-bedroom apartment. And what I found was that the children couldn't speak Spanish because the parents insisted they speak English, but then the parents couldn't speak English and the children were their translators, which I know is not a new concept. That's been happening forever. But what it did is, because there are words for technology, like in business, in Spanish that the kids didn't know, they couldn't help their parents. And the kids kind of felt like, well, you don't know what you're talking about. And these undocumented parents were saying, don't go on the internet, they might find us. So there are all these things going on. So for me, using the word inclusion means that these children are losing their culture and who they are in order to become a part of something else in this dominant culture that has told them that they must become a part of it in order to engage in this, online society or this technological society. At the same time, they're still excluded because in this particular area, the wealthier children had access to Facebook and MySpace when I started the project, and then Facebook because I've been doing it for so long. But these kids were having conversations that these Mexican children couldn't even engage in, which again creates a divide, right? So we're talking about digital natives, and the reality of it is that there's assumption that the youth have all this access. Well, they may have physical access, but what about intellectual? What about being able to produce online? I've had a lot of students say, well, I don't even see myself. A little girl didn't even know that there were Spanish language things online because no one had ever showed her, because in school you only use computers for serious games, keyboarding, mathematics, so on. They're not allowed to use Google. They're not allowed to do certain kinds of searches. So it really stunts their technological growth. So that's why I don't like the word inclusion. I like the word fusion because in using, Cherry, I'm going to forget her name, but a poet out of UC Berkeley wrote a poem about fusion. And she talks about the beauty of melding parts together and how the fusion, the heat, because there's conflict, there are challenges in fusing something together, but it can create something really beautiful. So the art creative part of me, which is like this big, liked fusion, but I can accept equity as well. I think equity is another good term. Sorry, that was a really long explanation. But we're going to take questions now from everybody. So I guess I'll just sit up here and moderate questions if you have for each other. So thank you. Thank you, sorry. Anybody, questions?
Well, go. So, yeah, this is great to hear. It's great to hear all the projects too, where they're coming and where they're going. I'm curious, I know that, I guess thinking about the Malawi project, and one of the things that I think you said you had in your slides was that people went to clinics, they took the advice, even though they didn't necessarily think in the short term that was the right solution. And I'm just sort of interested in kind of hearing more about that and what your sense of was in that. Similarly, I think in our other digital inclusion efforts too, as we're encouraging taking digital skills courses or something, like what's the tipping point that helps people, adopt those skills or get to those classes or take that advice?
I think the context may be different. It probably comes down to lack of options in Malawi. So what happens is the government runs these health clinics. You go all the way down to small health posts in the middle of nowhere. And the quality of the medical assistant or clinical officer that's running the place. They maybe had a training, 10 years ago. They may have a nurse or a midwife working there, guards and cleaners end up becoming pharmacists and giving medication out to people. So, and then you can imagine there are people who sometimes have to travel on foot or bike or whatever it is for miles and miles to get to this health center. And then you find a long line of patients waiting, and they might send you home at 4 o'clock because you're done for the day, and then you gotta go back and come back again. So one of the goals we had in the beginning of the hotline was to save people that trip. But then in talking to the Ministry of Health now more recently, they don't want us to save people that trip. They say your job is to do appropriate referrals to facilities because you're limited in what type of information you can give over the phone and not face-to-face with the patient. So the hotline tends to do great when it comes to preventive, giving out preventive health information. But if someone starts complaining about headaches and this and that, it could be malaria, or it could be this, or it could be that, you've got a fever, you're throwing up, you gotta go get a malaria test done. It's no malaria, they have to move from there to figure out what it is, right? So it's not always clear, but they're trained nurses. They've gone through the same training as the people at the health center, so they know how to probe. And that was one of the things we did. So when it comes down to answer your question, I think one is lack of options. You have these people who are very nice over the phone, who've got seriously trained customer care. The people at the health center might not be so nice. They're busy, they're rushed, they're constantly like patients coming. It came to trust. When we started asking questions about the level of knowledge that they thought the hotline workers had, the way they explained, were they patient, did they take the time? And the other thing, when we've done studies on how much time FaceTime patients have with clinical workers, we got at most 2 minutes. That's the average. While over the phone, there's no limit. So people will spend half an hour. We've got people calling about mental health nowadays because they need someone to talk to. We had an older man who had sprained his arm, nobody knew what was going on. The hotline worker couldn't figure it out over the phone. They sent him to the health center, they never could figure out what it was. It went away, and this guy becomes the biggest advocate for the hotline. And we're like, why? We didn't solve your problem. They couldn't solve your problem at the health center. And he said, they were so nice and caring over the phone. I trusted them instantly to care on. And that was very rare. So getting an older man to go to the facility from far away is already a big accomplishment. So it's about potential continuity of care. And people in some cases, in general, people don't really trust the health facilities, but they have no other options. I think it's that trust and that rapport that ends up being built, and that's possibly the entryway, right? The entry point to getting people to do certain things that they normally do.
These two services that you have, I can't remember, Airtel and then the one that doesn't offer the service, is there a price differential between those two? And
so it's free Airtel, that was the big thing.
oh yes, I know your services are free, but the actual service itself, is there a price differential to the person that has the service?
So far it's been the donors collectively, like U.S. government, German government, Johnson & Johnson funding the hotline staff.
Yes, exactly. But what I'm curious is Airtel's the one that there is a partnership. Are they able?
Price differential because all they would have to do is say allow free calls to the hotline. Everything else in terms of infrastructure, staff, technology.
But they're not trying to leverage a price difference by saying, oh, if you choose these two.
No, it's a marketing thing because they feel that they got it first. So it's part of their corporate social responsibility. Why allow a competitor now? Then
Sure.
it's their
Then it becomes
marketing.
price of entry at that point, and everybody, so they're giving pushback. And the other provider, the major providers, I can't remember the name.
They're neck and neck, but they have about 50% of the market share.
Gotcha.
So
is there overlap between the two, or is it really about?
Yeah, so you can go, it depends on where you go. You can go to, if you belong to the capital, you have both.
Mm-hmm.
And of course, services can be patchy in the capital, but they can go up to 4G now. If you go to villages, some places are just Airtel, some places are just TNM, some places have both, some places have not. And you know, if Airtel are looking for more than TNM, I don't know. So they're fighting, but they tend to be both in the towns.
Are you optimistic about the second one eventually being?
So it's the government's job now, as the ultimate negotiator, to try to bring the bill on the table, which they said, oh, we no problem with in a year and a half.
Thank you.
I have a question. So, in the U.S., of course, all of this technology stuff sort of started with the telephone, right? And everyone should have access to the telephone, even if you can't afford the telephone service, you have access to that. So historically, this isn't that different. But my question is, in particular, if any one of you have cities that offers free Wi-Fi, free internet in the entire city to anyone who lives in a particular home, for instance, in Urbana-Champaign, PrairieNet offered free internet access to anyone within the city limits. So this was during dial-up. So if you had a telephone, you could dial up. In a 2017 survey, 2.1 million people still use dial-up. I don't know if people are aware of that. Those who actually have landlines still, AOL still provides dial-up service. So I'm just wondering if you know of any
The
cities.
city of Oakland offers free internet to any school-age child that qualifies for free or reduced lunch.
Okay.
Any household that has a school-age
Okay.
child.
Okay.
But again, that's the closest I know of, and it still needs tested.
Do you know how they do that?
In terms of the actual program or how they provide it, I mean, I think they're providing it through the ISP.
Right,
But
so they're
the-
partnering with ISPs and.
Yeah, so like in Seattle, there's certainly programs that are from the ISPs that offer low income and
Right.
reduced cost.
Right.
Comcast offers their major broadband provider there, and they offer a program. And one of the qualification points is free or reduced lunch for a child, but it's not free. And in Oakland, I don't know the specifics of it, but the former CIO of City of Oakland is now the CIO at the Seattle Public Schools. And so that's one of the things that he's looking at, since he knows it has worked in other cities.
In Provo, Utah, Salt Lake, or Google Fiber came into Provo, Utah, and so they have a very reduced access to anyone, and I think there's some free Wi-Fi throughout the public, but that was a very unique deal in where they had $30 million of infrastructure that needed $20 million to finish it, and so they sold it to Google for $1 with the intent that they would finish it, right? One of the things that I'm finding when some of the cellular companies that are coming to us and some of the others they're saying we're going to offer a very low price, but it's also they're saying, well, but we're going to give you just a tiny little bit of bandwidth.
Oh
right?
yeah, that's happening in Seattle.
Right, and so my last conversation with one of the local providers is that I'm not going to promote that because they're saying, well, that's just basic internet. That's all those people need, right? And I took great offense to the statement that the government liaison said when she said, well, that's all those people need is 2 megabits, or I can't remember what it was. And I was like, well, I'm not going to promote your plan. I'm sorry. And we're not going to make a partnership, right? Because I need
The question of advocacy is absolutely one that we have to have. I mean, it's not just about whether or not you actually have access. It is about, can you get what you need done? And that transcends to devices as well. Especially as you talk about school children. Like I have a child in public schools, and they use adaptive learning, which is phenomenal. I 100% agree with what you're saying in terms of just making homework really relevant and appropriate and efficient. But not only do you have to have adequate internet, you also have to have the latest device.
Well, that's where equity comes in, right?
Exactly.
That's why equity is important. It can't just be fusion. The equity is an incredibly important part of that. So, as my 9-year-old sits back there on an electronic device, so it was working. Single mom can do this. So yeah, but it's very important.
We've heard the skills gap, right? And a project I got to work on was the White House Tech Hire Initiative a few years back, and I got to be really close. I actually got to write the introductory speech for that at the National League of Cities randomly. Our mayor was doing it. For some reason, they thought I knew something, so I wrote that. But how are you guys putting the skills gap, that employment gap within your strategic plans? Because we talk a lot about access to device, access to service, access to basic education for navigation, but that skills gap really is that new economy thing, and I'm struggling to figure out how you do that within a strategy or within a policy.
So, I mean, for Seattle, we'll just one quick comment back on the sort of Wi-Fi and connectivity. Yeah, I mean, we're being more cautious about endorsing program and pointing out the differences in those. And Comcast's low-income internet program has huge barriers to entry as well. And we don't have a citywide Wi-Fi. We've done Wi-Fi in public buildings, and we've had a couple smaller initiatives, but in general, that strategy, if we're going to do it, is a little bit more focused to targeted areas that some sort of say is lily pads, and where it's needed, and understanding it's not a full solution to connectivity for folks either, because it doesn't penetrate buildings and so on. On the skills gap, I'm actually going to talk tomorrow about kind of a skills competency comparison matrix we've been doing. I think that it's a really big challenge, I think, both in terms of like policy of where you invest. When there's, somebody mentioned it this morning that seniors, disabled, just young folks, and how does that change? So, I think wherever we've got policy moving forward or opportunities around immigrant and refugee services, around youth education, economic development, we're pushing digital skills as a component of whatever development, economic or skills and stuff. But I think part of that challenge is appropriately kind of framing that. So, so I think we're seeing an increase in knowledge of needing to tool up for different things. Also, it's tooling up for different city services too. Right. I mean, our expectation, this is an area I think it'd be really interesting to share among cities too, because the expectation of delivering online government services has grown, and so what's the set of baseline skills that you need to even interact with government or to transact or to provide input?
That was one of the things that really resonated this morning when they were talking about the UK and how they're still, really back here on this assisted skills. And like in Seattle, they've already left that, and now it is an expectation that you can engage digitally. There is no one there to help you if you want to do a basic thing like find the bus schedule or how do I get from point A to point B, or I often tell the story of my mother who is 72 years old and would be, she has access, she has basic skills. She left her eyeglasses on a bus, on the city bus. And so she tried to get it back, and there was no way for her to file a lost and claim other than electronically. And she was outraged because she wanted to talk to a person. She wanted to go in. She wanted to know that somebody was connecting with her on a human level, and that's just not possible. So it's a very, very different kind of conversation.
Okay, so we are past time. That clock does not work. But thank you all. And I just wanted to close by saying, because I think what we were talking about at the end here is something that I learned in the 90s, is that ICTs impact face-to-face online realities. So like doing these things to get people jobs is fine, but if they don't understand like how to dress, showing up, the importance of showing up on time, the importance of calling in when you're late or can't make it. I found in my research that those became really huge things. So even having the technology did not always mean success. And that's why collaboration is so important across different agencies and so on. So I just wanted to throw that out because I think that's what we were just talking about a little bit. So thank you all for this, for presenting, and I've learned a ton. So thank you.